The diagnosis of cancer can be incredibly isolating for people. And what we want them to know is they're not alone in this. While we don't have a crystal ball, we can't predict what the future is going to hold. No matter what happens, every step of the way, they have us, their team, and they have support groups as well, and of course their families that they can lean on in these difficult times. When patients first come and see us, often they're fearful, and a lot of the fear is fear of the unknown. They have this diagnosis of cancer, and they don't know how this is going to affect them as a person, as far as their health goes, as well as how is it going to affect their ability to work. How is it going to affect their quality of life? What about their family? What about their future? And the first thing we do when we first meet is we listen. We try to understand. We try to understand what symptoms a person's having. How are they affecting an individual? And then after listening and doing a comprehensive examination, we talk. We talk at length about the diagnosis, what we expect to do in terms of the staging workup, which really determines what the extent of the cancer is. And then based on the testing results, we come up with possible treatment options. As far as treatment options, we try to be as open and honest, but at the same time, talk in plain, simple terms so that everyone can understand. And also, we discuss what is the standard of care and what possible clinical trials we have at our institution that could potentially enhance what we could get out of standard of care treatments. A lot of our patients who come to us, often for second opinions, have great relationships with their existing oncologists, and that doesn't end when they come here to Siteman Cancer Center. We partner with their local oncologists to provide them the best care that they can get. And whatever we have here that they don't have access to closer to home, we provide here, while at the same time keeping their local oncologists in the loop as well. Siteman Cancer Center has made special efforts to bring cancer care to our patients in the community, right where they live. And we have multiple satellite sites in various community settings. I got into medicine because, I really enjoy doctor-patient relationships and being able to understand disease processes and really figuring out the different pieces of a puzzle. That's what I feel like all diseases are. But the pieces of the puzzle are different for every different person. Figuring out how we can really impact a person's quality of life, how we can make them feel better. That's really what drew me to medicine in the first place. And then oncology was more an academic interest in, the processes that cause cancer and really being able to study more about those and then bring better treatments for our patients. Cancer treatment, especially for lung cancer, has really dramatically changed over the past several years. Initially, our treatment options comprised primarily of chemotherapy, and these days, our treatment options are so vastly different with all these targeted therapies that have been approved, and immunotherapy, which allow us to harness the power of the immune system to fight the cancer. Over the past 5 years, we've had more drugs approved than we've had in the 10 years prior to that, and this is exciting for our patients as well as for us because that brings options and that brings hope. I'm very hopeful that as time goes by, we'll be able to bring even more treatment options to our patients. Many of our patients have participated in clinical trials that led to the FDA approval of many of these agents, and they got access to these drugs well before the general public did. And in addition, they were able to impact the lives of others, not just their own, and therefore help make cancer care better for all.